Hi, everyone. Welcome to a Senior Citizens Forum presented by Benefits for You 2 Insurance Services. I'm Janice Wood, and today on the Senior Citizens Forum, we are going to be talking about Medicare. So this is a Medicare 101 class. It's going to give you some educational information about what Medicare is all about, who qualifies for Medicare. Open enrollment period, as you know, or starts on October 15th and goes to December 7th. And I'm going to go over that a little bit more a little later on our presentation. But I'm excited that you're here. And I have a lot of valuable information to talk about that talks about Medicare insurances. Okay. So Medicare, this is a Medicare 101, as I said, and we're going to talk about who qualifies for Medicare. What's this? Stop. Yeah, hi everyone. Thank you for coming to the Senior Citizens Forum. I'm Janice Wood, and the Senior Citizens Forum is presented by Benefits for You 2 Insurance Services. At Benefits for You 2 Insurance Services, our specialty is Medicare insurance. So I'm going to be doing a Medicare 101 today. And open enrollment, the annual election period will be starting on October 15th through December 7th. But right now, you can give me a call, ask me questions. But on the 15th, I can actually start taking applications to change your plans if that's interested in what you're doing. So let's start our presentation here. And we're going to go with our Medicare 101, which is on the screen. And we're going to talk about now who is eligible for Medicare. So who is definitely eligible? If you're age 65 or older, of course, you can qualify for Medicare. So if you are over the age of 65 and you're still working, you should be picking up what Part A is. And I'm going to discuss that in a couple of minutes, what Part A is. You will not need Part B, and I will tell you why in the next few minutes, why you will not need Part B. But once you go and retire, you can pick up both Parts A and B. Also, you qualify for Medicare if you're under the age of 65 and you are collecting Social Security disability. That's SSDI. People get that confused with SSD. Excuse me. I'm gonna go back. Start over. That was wrong. I'm recording.
Do I have to leave?
I have to start over, but not because of you. I was starting over to begin with. Hi, welcome to a Senior Citizens Forum. I'm Janice Wood, and the Senior Citizens Forum is presented by Benefits for You 2 Insurance Services. At Benefits for You 2 Insurances, we are brokers, and our specialty is Medicare insurances. So because it is the annual election period that's coming up, starting October 15th, going to December 7th, it's a good time to have your existing Medicare plans reviewed. May it be a Medicare Advantage plan, may it be a prescription drug plan, or if you want to talk about your supplemental plans. This is a good time of year to do that. But because this is a Medicare 101 class, I'm going to share my screen here and bring up my Medicare 101. And we're going to talk about who qualifies for Medicare. And it's people usually age of 65 or older. It's people that are on disabilities, that have disabilities and receiving SSDI, which is Social Security Disability Insurance. Sometimes that gets mixed up with SSI. It has to be Social Security Disability Insurance, SSDI, that you have, and you need to have it for 24 months. And it doesn't really have to be consecutive, but you have to have it for 24 months. So if you have that and you get your Medicare card, I gotta start. Yeah. Here we go again. Hi, everyone. Welcome to a Senior Citizens Forum. I'm Janice Wood, and a Senior Citizens Forum is presented by Benefits for You Too Insurance Services. Today, well, let me go back real quick. Just started over. Hi, everyone. Welcome to a Senior Citizens Forum presented by Benefits for You Too Insurance Services. I'm Janice Wood, and today we're going to be discussing Medicare insurances, or what is Medicare on a 101. It's open enrollment time, which starts on October 15th, that goes to December 7th, when if you already have an existing plan, you can change plans, you can keep what you have. If you have just straight Medicare and you want to pick up a Medicare Advantage plan, we'll even talk about supplementals, but that's a little bit different. Or we may want to look at prescription drug plans to add to what you have. I'm going to describe all of this as we go on in the presentation. So because this is a Medicare 101 and at Benefits for You Too, we specialize in Medicare health insurance plans. I thought this would be a great time to have a Medicare 101 class. All right, I'm going to bring up my screen, share. Okay, so who's eligible for Medicare? All right, when you turn age 65 and you're older. So that means if you're 65 and you're still working, you still qualify for Medicare. You should at least pick up Part A. There's so many different scenarios, but please contact me and I can help you figure out what scenario you're in. Also, if you're under the age of 65 and you are receiving Social Security Disability Insurance, that's SSDI, not Social Security Insurance, but SSDI, Social Security Disability Insurance payments for 24 months or more, you should have received in the mail a Medicare card. So real quick, I'm going to show you this book right here. It's called Medicare and You. So if you're receiving Medicare or you're over the age of 65, you should have gotten this book in the mail at the end of September of this year, because that's when I got it, in the last week of September. And in here on page 9, this is what the Medicare card looks like. It's a red, white, and blue card. So if you receive that in the mail from Social Security, you qualify for Medicare. Also, there's a few illnesses that will automatically qualify you for Medicare. That would be end-stage renal disease. So that's if you're on kidney dialysis and you're in that arm, you're going to be can receive Medicare. Also, some people know it as Lou Gehrig's disease. Others may know it as ALS. You automatically, along with the end-stage renal disease, qualify for Medicare. If you are a resident a U.S. citizen, or you have permanently resided for 5 years consecutive in the United States, you will qualify for Medicare insurance. Over this last year, I have a friend who happens to be a an immigration lawyer, and he called me with a question saying, I know someone who has been living in the United States and they're in their 70s and they were from another country where they worked all this time. What do they do? So I did some research on that, and I found out that the United States has contracts with about 500 other countries, that if you go to that country or you come back into this country, that that there's a way that they share those benefits back and forth. So it was really interesting research that I did. Okay. If you have Social Security already before you turn 65, you automatically, about 3 months, sometimes it's a little earlier than that, will receive your Medicare card in the mail. So that would be about 3 months or a little bit, almost 4 months before your birthday month. You should be receiving that Medicare card. If you don't have Social Security when you turn 65, you will need to sign up for Medicare. There are 3 ways that you can go about doing it. Now, I just finished signing up for Medicare, so I'm really familiar with this right here. You can go online and you can apply at www.ssa.gov. That's a good way, because I had some extenuating circumstances that didn't fit their application. I actually called this number, and at that number, I requested that I would speak to my local Social Security office, and they were able to help me with the situation that I have. So you can do it that way. You can call this number, which I recommend you call maybe a little later in the day, because this is a national phone number, and you request that you get an appointment through your local Social Security office, and make sure you ask them for that local Social Security's phone number. Or you can go directly to the Social Security office. Now, I would say a couple of months ago when I was doing this, not all the Social Security offices were open, and they were only taking appointments. So you can either go online. You can go online to make that appointment at www.socialsecurity.gov, or you can call this number to make the appointment for your local office. And I know a few months ago, which it may have changed now, not all of the Social Security offices were open. Now we're going to go over basic Medicare. Okay, hold on. Yeah. So basic Medicare, remember I showed you this card, and on this card, it will have your name. It's going to have your Medicare number on it, and it's going to have Part A and B. And if you look on here, the card will say that it's hospital insurance, and Part B is your medical insurance. Okay. And I'm going to go in a couple of minutes over more detail what each of that covers. In addition, private insurance companies that I represent, because I don't work for Social Security or for Medicare, but private insurance companies who have approved Medicare contracts with Medicare can provide you with a supplemental plan. They can provide you with a Part D plan, which is your prescription drug plan, or you can select a Medicare Advantage plan. And I'm going to go through all the little differences of them. But just really quick, you can have Part A, standalone, and Part B, which we call original Medicare as a standalone. But if you do that, you need to pick up a prescription drug plan. That's really important. And I'm going to describe to you why in a couple of minutes you need to do that. You can also have a Medicare A and B plan, but you're going to need, you can also pick up a supplemental plan. And I'm going to tell you why you would do that. Or you can pick up a Medicare Advantage plan, which can be an HMO plan, it can be a POS plan, it can be a PPO plan. And on here, if you look at these little icons, you're going to see that it covers the hospitalization, it covers the medical. If you look over here, a little icon, and it will cover the prescription drug. So I hope to get that. There's more explanation of that as I go on. Okay, so what is Part A? Part A is hospital insurance, but it also includes inpatient hospital care. It includes skilled nursing care. It includes hospice care and very limited home health care, which has become a lot popular over the last couple of years. It covers many other things. This is not a complete list, but these are the major items that it covers. Part A premiums, when you pay into Social Security, 40 quarters, which equals 10 years, there is no premium for Part A. But if you paid at least 30 quarters, you're going to pay in 2023, you're going to pay $278. In 2023, if you have less than 30 quarters, you're going to have to pay $506 in for your Part A premium. Now, over the years that I've been doing this, and I've been doing this for over, I think it's getting close to 15 years now, I have one client that pays for this. It doesn't happen too often, but it is out there, okay? Now, one of the things a lot of people don't realize is that you may be eligible using your spouse's work history when you turn 65. So if you're home and you're working, if you're home and you're not paying into Social Security, say you're taking care of the children, but your spouse is out there working, you can use their Social Security number to qualify for Social Security. Okay. Medicare Part B, which is your medical insurance, which is your doctor's offices, it's your preventive care services, it's your outpatient surgeries, it's your diagnostic screenings, it's your emergency care, it's your dual medical power of attorney. I always get a couple of times a year somebody asking me about, does my plan cover dual power medical attorney? Yes. Part B all covers durable medical equipment. If you paid into Part A, you didn't have a premium. If not, if you had 30 years, you paid some money, and 40 years, you paid $506. But Part B premium has a cost. Everyone pays it unless they qualify for Medicaid, or in the state of California is called Medi-Cal, okay? But if you don't qualify for that or extra help, which I'm going to talk about in a few minutes, then you're going to pay for 2023 $164.90 if you make as an individual 97,000 or less, or if you file jointly 194,000 or less. If you file married and separate taxes, you're still going to pay, and less than $97,000, you're going to pay $164.90. That has gone down from 2022. So that's really exciting for all of you. If you see on the scale that you're making more than the amounts of money here, so if you're making more than $97,000 to $123,000, you're going to pay $230.80. And we're talking gross amounts. Definitely, this is gross amounts. Okay. And you see how it goes up as you go up into higher incomes. You will pay more. Okay. Now, if you don't pick up Part B in time, there is a late enrollment penalty. So if you don't sign up for Part B when you are first eligible, or you're not covered by an employer plan. So if you're 65 and you're still working and you want to keep your employer plan and you don't start out, pick up Part B, that's okay. You're not going to get the penalty. But where you will get the penalty is if you do not have proof of credible insurance from an employer or a union. Okay. If you don't pick it up, if your monthly premium may go up to 10% for each full 12-month period that you have not had Part B. Now, I've been doing this, as I said, for like over 15 years now. I don't think I've really come across this. I've talked about it, but I haven't really come across a client that has that. So it's very rare, but I'm sure there are people out there that could happen too. Here they're talking about if you have an exception, if you do not have to pay the late penalty, if you meet certain conditions that allow you to sign up for Part B during a special election period. So that is an exception. Original Medicare doesn't cover everything. It doesn't cover your deductibles, because there is a deductible with original Medicare. It doesn't cover your co-pays or coinsurance. So real quick, a copay is a specific amount that your plan states. So in your benefits, it says 0 copay. When you go to the doctor, you will pay 0. But if you go to that doctor and it says you have to pay 80%, that is called a coinsurance. So you usually are going to have to pay that. Medicare Part B is usually Medicare pays 80%, and you will pay 20%. It doesn't cover you outside of the United States. And I've run across people who all they had was original Medicare, and they got sick outside of the United States, and they found themselves without any health care coverage. I have one client who had a stroke in another country. That country, of course, wasn't going to recognize Medicare, but they did have, it's called socialized medicine. That client, when she had that stroke, if you're treated within 6 hours of getting that stroke, they can give you a shot that will put you back to normal. She was not treated. I can't remember how long she was not treated, but she wasn't treated right away because they didn't recognize her insurance. She came back partially paralyzed, and she had a hard time talking. I have another client that had a stroke. Actually, she went to a different country. She had a Medicare Advantage plan. Everything was covered. Everything was taken care of. And she was in she was real happy when she got home to find out that everything was being paid for. Hearing aids, exams, and screenings are not covered under original Medicare. Routine eye exams and most glasses are not covered under original Medicare. Remember a little bit ago, I talked about Medicare supplemental bills? Well, you can have original Medicare and pick up a Medicare supplemental plan, okay? It can cover some of your deductibles, it can cover some of your co-payments and your co-insurances. What the biggest benefit of it is that you have freedom to go to choose any Medicare appointed doctor in the United States without having to worry about any approval. Standardized plan letter with associate benefits it does have a monthly premium, and it will vary according to what county and zip code you're in. So if you live I happen to be in LA County, and in LA County, if I were to go up to Sacramento County, it would definitely be different. So if you deal with an agent, they need to check the zip code to see what your monthly premiums would be. Now you see all these letters, A, B, C, D, E, F, G. All these plans are available in the area. Depending upon the plan is what it covers. So if you look at this here, you see that all the plans, they cover almost 100% of the hospitalization. Now, when we look at the Part B premium co-insurance and co-payments, A, B, C, D, G almost pays everything. K pays 50%, L pays 75%, M and N pay 100%. And over here in this column here, you see that C and F will cover this. Okay. Now I'll talk about C and F for just a second. So that means if you qualified for Medicare before 2020, that was by the end of 2019, then you would qualify for these two plans. Anybody afterwards, they would be looking at these plans. Here we see the differences in the hospice care. Here we see that plans A and B, they don't have any coverage at all for nursing facilities. You see some of these have 100%, D and G, where K and L are only paying 50 to 75, and over here to C and F, it's 100%. So if I look down, it does have a deductible. So you have to look in here what it pays under the deductible. So you see that B, D, and G will pay 100% of the deductible. K and L and M only get paid 50% and 75%. And over here, N and C and F will pay 100%. So if you look over here, the Part B deductible, all of these plans do not pay the Part B deductible, but if you have an F or C plan, it will cover the Part B deductible. There's also an excess of coverage, and you see the difference right here. What plans cover it and don't. Travel outside of the United States, depending upon the carrier, is how much they will cover you outside the United States. And this shows it right here. Medicare supplemental plans do not cover prescription drug plans. okay? Drug plans, you will need to get a separate drug plan if you have a supplemental plan, or if you have other credible coverage. Part D, prescription drugs. So it will cover, I'm going to go a little bit more detailed than what this is. So Part D prescription drug plans have a formulary. A formulary is a list of all the different drugs. All of those drugs and on the formulary have to be approved, by CMS. That's the Center for Medicare and Medicaid Services. Okay, you can get that. Each of the different carriers and each of the different plans can have different formularies and what they cover. I have a client who has a plan. We looked up all of her drugs. I always research the prescription drugs that she takes. And at that time, her prescription drugs were all covered. Go to find out during the year that her doctors changed her medications and those prescription drugs were not covered. There are two types of Part D coverage. There's a standalone plan or with an integrated Medicare Advantage plan. You must be enrolled in A and or B and live within the plan service area. Premium costs for Part D. So if you make $97,000 or less, or $194,000, you're not going to have a premium. But if you make more than $97,000 or $194,000, you're going to have to pay, you see it over here, $12.20. And if you look at the chart, you see how it is constantly, it is increasing. This is real important to know. Part D does come with a late enrollment penalty. If you don't sign up for Part D when you're first eligible and you did not have credible coverage for more than 63 days, you're going to receive a penalty. And over the 15 years that I have been doing this, I probably have about 5 clients that have penalties. This is how, if you look down here, this is how the penalties are figured out. It's 1% of the national base premium times the national gross index, which is going to be $32.74 in 2023. Then you're going to multiply it by the number of months that they weren't eligible. So if you feel like it's important, you think you're really healthy, and you don't really need prescription drug coverage, there are really some premiums that are really low out there. I recommend to you that you do get it, because as we get older and as we age, more things go wrong with our bodies. Now, within the prescription drug area, there are 4 annual stages. So what I'm going to do real quickly, remember I talked about the formularies and how they had, all the formularies had to be approved by CMS, and how I go back and I research all those, what your prescription drugs are, to make sure that you have the plan that's going to cover what you're taking at that time, okay? But there's also something that's called stages. So if you pick up a standalone prescription drug, you're definitely going to start in stage one. Stage one is going to have a deductible that's $0 to $505. The majority of my Medicare Advantage plan that have Part D embedded in it, they usually will start in stage two. And I'm going to talk about Medicare Advantage plans, Part C plans in just a minute. Okay. So once you and the plan once you paid your deductible or you started stage two, once you and the plan spend together $4,660, then you move into stage three. Stage three is called the coverage gap. Coverage gap, and some people will refer to it as the donut hole. And once you get into that gap coverage, once you spend $7,400, then you would move into stage four, which is the catastrophic coverage. And then your prescription drugs become 5%, it becomes $74, it becomes $184, or $415 for generics. This is all what it says right here. Everybody has to remember, with these plans, it always starts over every January. So everybody starts either here or here, January 1st. Not everybody moves to stage three, and not everybody moves to stage four. But I can usually tell by the prescription drugs that you take. I've had several clients that take some real expensive drugs, and I know that they go through these stages really quickly. So it's important that you either get it either online or you get it by mail. You get a summary of how you're doing all the time and where you are in the different stages. So you should be looking at that to see what you paid, to see what the plan paid, or, and if you're like me, I have a group Medicare insurance, and some of it, there's things that are covered under my group Medicare insurance, and it falls under there. So that's going to count towards all of these different stages. Okay. Now, if you are at a lower income and you need help paying for your prescriptions, you may qualify something that's called low income subsidies. And below you see on Social Security.gov, the Medicare section, where you can apply for help. You can also give me a call and I will help you out with that. I've done that with quite a few of my clients. And it will help you. It will help you out a lot if your income is low. Now we're going to talk about Part C plans. And Part C plans combine Parts A and B. And in a lot of instances, it includes Part D. And they're also known as Medicare plans or MAPD plans. And you get those through private insurance companies that I represent. Same thing with the prescription drug plans and the supplemental plan. I do all of those, okay? So the Medicare Network, you can choose your primary care physician. If it's a HMO, there are some non-HMO out there. There are also some POSs and some PPOs. They may offer benefits that will fit your needs and are not based on any criteria. You don't, for For Medicare Advantage plans, there's no underwriting. And they may offer additional benefits. So some of the benefits that they may offer would be hearing aids, transportation to and from the doctor's office. Some of them, I have one that does pet sitting if you're in the hospital. They all different plans offer different things. The glasses will come underneath that. That will be covered under these plans. Okay. So here there are enrollment periods. So when you first turn 65, they have something that's called the initial enrollment period. And that is a 7-month window. That's 3 months before your birthday month and 3 months after your birthday month that you can enroll in a Medicare Advantage plan. I recommend that you should look at doing it as soon as you get that Medicare card that has A and B on it. The annual enrollment period, which we're going into starting October 15th, and that will go to December 7th, you can change your plans. You can look at your supplemental plans, and maybe you decide for different reasons you want to go into a Medicare Advantage plan. You can change your Medicare Advantage plan and go into a different Medicare Advantage plan. You may want to talk about a supplemental plan at that time. Also, if you have a standalone prescription drug plan and you want to see what other benefits are out there. So like my client that I was talking about earlier that didn't find her drugs on there, I'm going to be meeting with her and we're going to be going over all of her prescription drugs. Okay. The open enrollment period. This starts January 1st and goes to March 31st. This is something that a lot of people are not aware of. During this period, if you have a Medicare Advantage plan, not a prescription drug plan standalone, not a supplement plan, but a Medicare Advantage plan, and you're not happy with it, you can change the plan from one carrier to the other, or maybe there's another plan that you want to go to that the same carrier has. You can change it one time from January 1st to March 31st. The lock-in period is April 1st to December 31st. So what you have after April 1st through December 31st, that's what you have to keep. Except remember, when you're this, you have to wait for this to open up. Now we have special enrollment periods we're talking about here. So I just actually had a conversation earlier today with a friend of mine who has moved states and she need to get new medical insurance. So if you're moved from one state to the other, or even from one county to the other, or even within the county, you want to make sure that the doctors that you're going to are taking your plan. Okay. So you would have a special window 30 days before you move and 60 days after you move to make that change. If you are a dual and you want to change your plan, you can do it one time in each of the quarters, except the quarter starting October 1st. You have to use the annual election period to change for January. Here we're going to talk about Medicare supplemental plans. Medicare supplemental plans are different when you turn 65. It's a 6-month window that goes into effect when you have your Part B date from your 65th birthday. So from your 65th birthday to 6 months later, you will qualify when you first qualify. In there, they have something that's called the guaranteed issue period, which means there's no underwriting. The supplemental plans do have underwriting, and they will ask you your medical questions, where they don't do that in your Medicare Advantage plans. You can choose from any supplemental plan option that is available in your area. All of these plans are star rated. They have star ratings. And the star ratings is done on member satisfaction plans and the providers. Performance measurement based on 50 key factors. Additional information is available on Medicare.gov. So you remember really quickly, I showed you this book. So if you have this book and you go into this book, in the back of this book, it has all the different plans in your area. And it will give you what they call the plans ratings in there. These plans ratings are for the calendar year 2022. They're not for the calendar year 2023. So by the end of usually October, the end of November, the new star ratings will come out for 2023. COVID coverage, real quick. What is the COVID coverage? This is it. The FDA has authorized the FDA approved COVID-19 vaccines, and you pay no out-of-pocket costs. The COVID-19 lab tests, you pay nothing out of cost. The FDA authorized COVID-19 antibody tests. All medically necessary hospitalizations for quarantine purposes. You will still pay for any hospital deductibles, co-pays, or coinsurance that applies. MAD plans may offer additional telehealth benefits and expanded benefits under the COVID. But one of those extra benefits that we're talking about right now, your medical groups and your insurance carriers usually will have some form of telehealth benefit to help you out. So I'm here with a lot of different options that I'm able to help you with. If you're continue working with your employer, you're still working, I can give you advice. I do that all the time. If you continue with your retiring military plan, you're covered. If you're enrolled in Part C, Medicare Advantage plan, which includes Part D, I can definitely help you. Or if you want Part D standalone or a Medicare supplement, I love to be able to help you. Okay. During our consultation, I like to review when your Medicare starts. I always review that. I definitely look at the zip code that you're in. I definitely want to look at your primary care doctors, and I also look at your specialists. This is important because sometimes I may find someone that has one doctor that they need to go to. So I have a client who wanted a Medicare Advantage plan. All of her doctors, except her mental health doctor, was covered under the Medicare Advantage plan. So I figured out what the cost she pays going weekly to the Medicare, to her mental health provider. And it was much better for her to be on a supplemental plan and pick up prescription drug plan. So I like to look at the different variables before we choose a plan. And I like to educate you also on how to do that. I definitely want to look at your medications. This is an important year because there's going to be a lot of changes in the medications. And we also look at what additional benefits that you may need. I may not need the same benefits that you need. Or let's say we go to a married couple that live in the same house, or siblings that live in the same house. They may not have the same needs, and the same plan may not fit all of their different needs. So I love to hear from you. I love to answer any questions that you have. I'm here to help you at no cost obligation to you. If you don't select anything, if you're already my client and all we do is review what your benefits are, that's really good to know, because each year there's different benefits that you may find out that you weren't using. This is my phone number. Okay, to give me a call, 747-205-4364. You can also go on Janice Wood at benefitsforyou2.com and find my site. And if you're looking for any testimonials, they're on there. So thank you for participating in my Senior Citizens Forum. If you have any questions, I would be more than happy to answer any questions you may have. So please give me a call. I love to hear from you. Hope to be hearing you soon, and hope that you'll enjoy our next Senior Citizens Forum that we will have. Thank you.